Did you know? Every wound is not the same. A small cut, a burn, a crash injury, each one heals differently and needs different treatment. Today we will learn complete wound classification in a simple way. First, let's get our definitions right. A wound is a break in the integrity of the skin or tissue. It is a disruption of any tissue like soft tissue, bone or even internal organs. But what about an ulcer? An ulcer is specifically a break in the continuity of a lining like skin or mucous membrane. An ulcer is a type of wound, but not all wound are ulcer. The first classification system we are looking at is the rank and Wakefield classification. Doctors often use the rank and Wakefield classification to decide how to treat you. It divides wound into two broad groups, tidy and untidy wounds. Tidy wounds, thick surgical incision or cut from a sharp knife. They are clean, healthy and have no tissue loss. These are usually closed with immediate stitches known as primary intention healing. Untidy wounds. These are messy. They come from crushing, tearing, burns or vascular injuries. They often involve infected or dead tissues. You can't just stitches these up. They often need to heal by secondary intention. It means they stay open to heal from the bottom up or require skin grafts later. Now let's look at the specific type of injuries you will see in a clinical setting. First one is clean incised wound. This is a tidy, simple, clean cut wound with linear cut edges, usually caused by something sharp like a blade, glass piece or knife, treated by primary suturing. Second one is lacerated wound, a wound with raised edges and devitalized tissue. Here, the depth and the tissue damage must be carefully assessed. These need adequate wound excision, thorough washing and layer by layer suturing. Third one is bruises or contusion. A bruises or contusion happens when a blunt force hits the skin, damaging the blood vessels or capillaries underneath without breaking the skin. This leads to skin discoloration due to seepage of blood into the tissue below. It is common over bony areas, face, scrotum, around the eyes, and more commonly in children, elderly individuals, and people with fair skin. Fourth one is haematoma. A haematoma is a localized collection of blood following blunt trauma or surgery. Haematoma can be classified into subcutaneous, intramuscular, subfacial, or intraarticular. In subcutaneous haematoma, the blood collection under the skin. In intramuscular haematoma, the blood collection within muscle tissue. In subfacial haematoma, the blood collection under the fascia. And in intraarticular haematoma, the blood collection within the joint. A large haematoma can get infected and forms an abscess. So large one need drainage under general or regional anesthesia. Small hematomas like scalp hematoma usually get absorbed on their wound. Complication includes pressure effect and abscess formation. Both require incision and drainage under anesthesia. And one more thing, hematoma can also occur spontaneously in patients with coagulation disorder like hemophilia or in individuals on anticoagulant therapy. Fifth one is abrasion. An abrasion is a superficial injury caused by rubbing or scratching or pressure wound. Here, the epidermis is lost and exposing dermal vessels and nerves causing profuse and painful oozing. Abrasion healed by epithelialization. Any dirt or foreign body on the abrasion, it must be removed. If you leave it in, risk of forming a poor tattoo-like scars. Sixth one is puncture wound and bites. A puncture wound is typically caused by a pointed object, and here the depth is greater than the width. These are dangerous because they can hit internal organs like liver or spleen, and the foreign body might be lodged deep inside. These wounds need to be explored under general or regional anesthesia. The depth and severity assessed thoroughly and then sutured layer by layer after a thorough saline wash. Seventh one is penetrating wound. It is similar to puncture wound but caused by stabs. Common site are the abdomen and chest. Organ at risk include liver, bowel, spleen, major vessels, and other visceral organs. Ultrasound and CT scan are essential to evaluate deeper organ injuries, and proper surgical exploration under general anesthesia is required. Eighth one is traction and avulsion injuries. These are complex injuries where the tissue get displaced from their normal anatomical position and alignment. This can occur in a single plane like subcutaneous tissue or in multiple planes as seen in machinery injuries, major trauma, or deglowing injuries. Common problems include ischemia, bleeding, sepsis, and loss of wide tissue area. Open traction injuries occur on the surface, while closed traction injuries occur in deeper planes like brachial plexus injuries or traction bowel injury. After resuscitation, treatment like skin graft or nerve repair is required. Ninth one is crush injuries. Crush injuries are seen in major traumas, war wounds, natural disaster like earthquake or tourniquet injuries. They lead to compartment syndrome, muscle ischemia, tissue loss, gangrene, and sepsis. Critically, a non-viable muscle can be identified by four features: dark color with loss of shining, loss of contractility, turgidity, and failure to bleed when cut. Tenth one is gunshot injuries. These can be superficial or deep. There is usually an entry wound and an exit wound. These cause explosive and destructive injuries, including burn injuries in the deeper plane and organs. High velocity gunshot wound causes massive bleeding and major organ injuries. These are true surgical emergencies. 11th one is injuries to bone and joints. Common in all major injuries, must be identified clinically and confirmed radiologically. Specialized management like reduction, plating, or fixation is required. 12th one is injuries to nerve, arteries, vein, and deep organs. Requires immediate resuscitation followed by stage management depending on severity. 13th one is closed blunt injury. No obvious external wound but severe internal organ injury may be present. Now let's talk about classification based on the thickness of wound. This is especially important in burns and skin loss injuries. There are several levels here. First, a superficial wound. It involves only the epidermis and dermal papillae. And next, a partial thickness wound. It involves skin loss down to the deep dermis, but the deepest part of the dermis along with the hair follicle, shaft, and sweat glands are still preserved. And that's what enable reepithelialization. A full thickness wound, it means loss of the entire skin and subcutaneous tissue, causing the skin edges to space out. Skin grafting is usually required here. A deep wound, it extends beyond the deep fascia into muscles or deeper structure. A complicated wound, it is associated with injury to vessels or nerve. And a penetrating wound, it is one that penetrates into natural body cavities or organ. Now let's see classification based on structure involved. It is divided into two categories, a simple wound and a complex wound. A simple wound involves only one organ or tissue. A combined or complex wound involves mixed tissues. Multiple structures are damaged simultaneously. Let's see the classification based on time. First one is acute wound. It heals within 4 weeks. For examples, surgical wound, traumatic wounds, and burn wound. Healing stage includes 4 stages: hemostasis, inflammation, proliferation, and remodeling or maturation. Second one is chronic wound. It fails to heal within 4 weeks. Common causes includes diabetes, venous or arterial disease, and nutritional deficiency. Initially, hypoxia is actually a potent stimulus for fibroblast activity and angiogenesis, but persistent hypoxia impedes fibroblast and collagen activity and allows bacterial invasions, and that's what makes the wound chronic. Chronic wounds are also chronically infected with biofilms. A biofilm is a complex structure of microorganism contained in an extracellular matrix of protein and polysaccharides that adhere to a surface and creating a protected environment for those organisms. Biofilms interfere mainly with the inflammatory phase of healing, contributing significantly to non-healing. Chronic ulcers do not respond to dressing treatment alone. They require biopsy, culture studies, followed by definitive treatments like wound debridement, vacuum-assisted closure therapy, skin grafting, or flap surgery. If a specific condition like tuberculosis is identified, it must be treated. If malignancy is confirmed, wide local excision and skin grafting is the approach. And let's see the classification of surgical wound. Clean wound. Examples includes herniorrhaphy, excision and surgeries of the brain, joint, heart and transplant surgery. The infective rate is less than 2%. These are the gold standards of surgical wound. Here, no contamination and no risk. Clean contaminated wound. Examples includes appendectomy, bowel surgery, gastrojejunostomy, gallbladder, biliary and pancreatic surgery. Infective rate is around 10%. There is some potential for contamination, but it is controlled. Contaminated wound. Examples include acute abdominal condition and open fresh accidental wound. Infective rate is 15 to 30%. Dirty or infected wound. Example includes abscess drainage, biocil, emphysema gallbladder and fecal peritonitis. Infective rate is 40 to 70%. Thanks for watching. This video is for educational purpose only. Consult your doctor for proper diagnosis and treatment. If you found this helpful, for more clear and reliable medical explanation.